I think so. And, like the lower urinary tract symptoms, okay, as I said, it could be benign, but men tend to ignore this, put it off, and I have a hunch that they are presenting late. Yes.
So what do you think would be a best strategy to going forward, maybe with them?
Well, public education is good, and this can be done in a variety of ways. Pretty simple. I mean, not just having like you have breast cancer campaigns like that. Okay, okay.
Gender
So
equality
yes,
is
yes, right. So other than having little meetings in person and education webinars and stuff, you can also do one thing we need to do in this country is partner with the primary care setup, because that's where the rather illiterate, less educated people are, and they are the ones that we can't reach, and they are the ones who present late, right? So partnering with the primary care setup is important. And then of course there's social media nowadays, which can use celebrity endorsements, influencers, the list is endless, right? And I mean, you can do really one of my friends who's a urologist was saying, you can just put stickers on public urinals. Yes, you have difficulty in urination, go and see a doctor. It's very simple, right? Actually, there was a very interesting project done by a student in design, where they designed a beer tower, where the more beer you take out, the less comes out. So it's like decreased, like an urine obstruction. And then it says, if you have this problem with urination, contact your doctor.
We should put it in the vase, maybe. Thank you so much.
So you have given the mean,
Yes.
some 72 years or
Yes.
something like that.
Yes.
So I presume that the age also a major factor for the prostate cancer.
It is,
So,
because,
yeah, high
like,
correlation.
yes.
Yeah.
It's,
So could
less
yeah.
than 50 is extremely rare.
Yeah. So could you tell me that, the median of age group, whatever that 45 to
Yes,
93?
this is like an ongoing study. We haven't
Okay.
really looked at the median yet.
Yeah, that
yeah,
will
but
give us the-
yes, exactly.
Yeah.
But we did notice that a large chunk of them were over 65.
Absolutely, yeah. Because
Yes.
age is a major factor. Yeah,
Yes.
thanks.
Okay, thank you, Professor Isha. Now, I would like to invite our next panelist, Dr. Kanchana Vijay Singh.
Doctor, but there is a 3 months delay for the patient
Yes.
from the time they found the lump to see you. Do you think is this something to do with your cyclical changes? Because I mean, we have during menstruation with different phases, we feel the knot, or like we feel like we have a knot, and then we don't. But how can we differentiate that? To a breast cancer lump, because every time you feel like then you have a cancer, then you go to the doctor, then he said, no, it's just your cyclical thing. Then after that you become, we don't want to check it, you're shy to go back because of
Yes.
this. So I think I've heard of it a lot, but what's your solution for it?
I think that's a very good question, because when we advocate self-breast examination, we always tell that if you are a female who's having periods or menstruation, please don't examine your breasts just prior to menstruation, because we know, all females know, the breasts are very tender, nodular, lumpy just prior to menses. You start examining your breasts prior to menstruation, you'll have to go and visit doctor once a month. So you have no choice. So we clearly mention, if you're examining your breasts and you're having periods, you have to examine your breasts 1 week after menses. And if at that point you feel a lump, you need to get yourself checked. And it's okay to get ridiculed. Go and get yourself checked. Your health is your investment.
I have a little question, Kanchana. Now, you said that, people, they know about breast examination, but they don't do it. So, this is just a little example. There was an organization called Mituruela. They used to do this breast cancer education. And they used to take these public health midwives and get them to examine the women who come. And they find 3 per session with lumps, 3
Yes.
people with breast lumps per session, So is there a way of doing that, taking the mountain to Muhammad and, literally sending, when they come for other things, getting themselves checked?
Yes, we've tried that, at least to take a small hill to Mohammed. We've tried to get the midwives to go and check the breasts, especially when they encounter them during certain, like for when they are screening for pap smear and etc. The thing is, the midwives are already inundated with work, so it has worked to a certain extent, but I think the females should take responsibility of their own health. We can't take that issue away. They have to do self-breast examination. The moment we hand it over to somebody, the females will think, right, I'll wait for my midwife. So I think it's a good, we tried that, but we failed.
And we can say that we have the vaccination in our schedule now, so I think we will reach there fairly soon in our country, so I'm really proud to say that. But that's in the school setting, so it's for the younger children. But women who haven't gotten in the past, so I'm in my 30s, so I haven't got my HPV during the school time because it's recently introduced. So it's, even though we provided MOH and Family Planning Association, it's freely available, people are reluctant to go get the vaccination. What are the strategies we can use to, I mean, there's awareness again, like breast cancer for cervical cancer in Sri Lanka, but what are the strategies that we can use to bring them to get the vaccination? Even though there's awareness, they are not coming to get it, maybe because of the stigma or related things. So do you have any idea how we can bring them to get the vaccination in our country?
Sure. So I think that the community mobilization is key for all this type of social behavior change activities that you can conduct to improve these behaviors, right? So for instance, if you have social organizations that are women-led, I think that could be a good opportunity to speak with them and from this feminist perspective, so also you can improve their capacity to be gatekeepers and to be part of the ecosystem, the health ecosystem, the public health ecosystem. So in some areas, you can use this type of connections within the communities, but also you can connect not just to develop awareness sessions inside of these groups and these peer-to-peer groups, but also maybe to have the capacity to connect them with the health clinics or the system, right? So you have, I don't know, a secretary of health that is at local level, and you can maybe the person that is at the community level talking about or doing sessions, awareness session within this group of women, and you find out that this person would like to be vaccinated, but they don't have the capacity to go because they don't have maybe the funds, the resources to, because they have to pay or something. So maybe within these support groups, they can provide this type of like emergency funds to give their peers the possibility to go to the health centers to be vaccinated. So you can do some on-demand also activities, but within and throughout these organizations. It is even best when a peer tells you what to do, not the clinical or the staff, right? The provider, the healthcare provider is even, I don't know if it happens to you, but for me and my parents, they used to review the things in Google, and they don't believe in what I'm saying. So it happens the same in the communities. So they believe in each other, and they understand what is happening, and if there are any risk due to stigmatization or stigma and discrimination, it will be easy for them to manage this type of factors.
HPV vaccination is only for 9 to 14 years. Mm-hmm. No, it's not for, and the catch-up age is up to 26. And it's always more effective for women who are not exposed to sexual intercourse. So, yes, because they would have had HPV infection once they get married or once they're sexually active. So it is recommended 9 to 14, catch-up is up to 26 years. Beyond that, it is only screening. Mm-hmm. And screening, we were doing pap smear all these days. Now we know that HPV virus detection, HPV testing is done, and that is more sensitive. So at least WHO says at least once a woman should be screened by the time she's 40, at least once. But HPV screening costs money, much more costlier than a pap smear. And in some countries, they send an email or a telephone call saying that you're due for your date for pap smear or HPV screening. So reminders are sent to the women to come back for their screening, because it has to be done at regular intervals. HPV virus, if you're screening, once in 5 years. Pap smear is once in 3 years.
Thank you. If I may add to what is being practiced in our country, the public health system, every woman at the age of 35 is invited to get the pap smear screening done free of charge at the MOH clinics. And then if the report is normal, they are supposed to again undergo the second screening at the age of 45 years. So 45 and 35 are the age cohorts that we are currently targeting in our public health system. Today's mini symposium, I'd like to extend heartfelt gratitude to our 3 panelists for their invaluable presentations, and to all of you for your being an engaging audience. Thank you. So today's discussion have illuminated complexities of addressing prostate, breast and cervical cancers, from understanding their epidemiology, screening and the tackling disparities, especially in lower and lower middle income countries and in humanitarian settings.